Hello friends, welcome to Technology, Medical and Competitive World channel. Friends, today I will explain one of the communicable disease, that is cholera. Cholera, it is one of the infectious disease caused by cholera vibrio. Friends, today I will explain one of the this is one of the important leading communicable disease, that is cholera. Okay, you can see what is cholera means. What does the cholera means? Cholera is an acute infectious disease. Acute means this is short term. Short term. Infectious means the disease which is spread from one person to another person, that is infectious. Means the cholera is spread from one person to another person. This is caused by cholera vibrio. There is a bacteria that is called cholera vibrio which produce cholera in humans. Cholera vibrio is one of the bacteria which produce or develops the disease cholera in humans. I think you understand. Cholera is an acute infectious disease caused by cholera vibrio. Next, you can see the typical cases of cholera are characterized by the repeated purging and vomiting leading to rapid dehydration, often resulting in death. Okay, while the cholera, the disease develops, then what happens? It is characterized by the repeated purging and vomiting. Means while the time of cholera, there is repeated loose motion and vomiting occurs. That leads to the rapid dehydration, often resulting in death. During the time of cholera, what happens? There is repeated loose motion and as well as vomiting. Due to the repeated purging and this vomiting, there is loss of water takes place. Loss of sodium and water takes place. That leads to the dehydration. Loss of water is nothing but here dehydration. That results finally in the death. Next, you can see okay, you can see the epidemiology of cholera. Okay, epidemiology means there are some of the factors. Agent, in that agent means who produce disease or by whom or by which the disease develops into our body, that is agent. ಯಾರು ರೋಗವನ್ನು ಉಂಟು ಮಾಡ್ತಾರೆ ಅಂತ ಹೇಳಿದ್ರೆ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಕಾಲೆರಾನ ಉಂಟು ಮಾಡುವಂಥ ಸೂಕ್ಷ್ಮಾಣು ಜೀವಿ ಯಾವುದು ಅನ್ನೋದು ಇಲ್ಲಿ ಏನಾಗಿರುತ್ತೆ, ಏಜೆಂಟ್ ಆಗಿರುತ್ತೆ. Okay, which is the agent here? Cholera vibrio. Already I have told there is a bacteria that is called cholera vibrio. This is also called as vibrio cholerae. That bacteria develops cholera into human body. That is agent here. Next, age. Who suffer more by the cholera? All age group. This cholera is not restricted to particular age groups such as young children, young age, adults, old age, not restricted to particular age group, commonly affects all age groups. Next, incubation period. Yes, before going to the study of incubation period of cholera, initially we have to know what is mean by incubation period. Incubation period is the time interval between the entry of pathogenic organisms into the body and produce body response, or developing illness, or showing any signs and symptoms of that particular disease. That is called incubation period. ಅಂತ ಹೇಳಿದ್ರೆ ಇವತ್ತು ಇನ್ಫೆಕ್ಷನ್ ಆಯಿತು, ಇವತ್ತು ಕಾಲೆರಾ ವಿಬ್ರಿಯೋ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಥ್ರೂ ದಿ ಕಂಟ್ಯಾಮಿನೇಟೆಡ್ ಫುಡ್ ಆ್ಯಂಡ್ ವಾಟರ್ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಹೋಯಿತು ಅಂತ ಹೇಳಿದ್ರೆ ಈಗಿಂದೀಗಲೇ ನಮ್ಮ ಬಾಡಿ ಏನು ಮಾಡಲ್ಲ, ಅದಕ್ಕೆ ರೆಸ್ಪಾನ್ಸ್ ಮಾಡೋಂಗಿಲ್ಲ. ಅಂದರೆ ಆ ರೋಗದ ಲಕ್ಷಣಗಳು ತೋರಿಸೋದಿಲ್ಲ, ಅಂದರೆ ಆ ಇಲ್ನೆಸ್ಸು ಸ್ಟಾರ್ಟ್ ಆಗಲ್ಲ. ದ್ಯಾಟ್ ವಿಲ್ ಟೇಕ್ ಸಮ್ ಟೈಮ್. ದ್ಯಾಟ್ ಟೈಮ್ ಇಂಟರ್ವಲ್ ಈಸ್ ನಥಿಂಗ್ ಬಟ್ ಹಿಯರ್ incubation period. Yes, what is the incubation period of cholera? Few hours to 5 days. From few hours to 5 days, that is the incubation period of cholera. Next you can see mode of transmission. Yes, mode of transmission means mode means this one of the path or route. Transmission means ಹರಡುವ ಮಾರ್ಗ. ಏನು ಹರಡೋದು? ಕಾಲೆರಾ ಹರಡುವ ಮಾರ್ಗ. ಯಾವ ಥರ ಒಬ್ಬರಿಂದ ಇನ್ನೊಬ್ಬರಿಗೆ ಕಾಲೆರಾ ಹರಡುತ್ತೆ ಅನ್ನುವಂಥದ್ದು. ಓಕೆ, ಹೌ ಇಟ್ ವಿಲ್ ಸ್ಪ್ರೆಡ್? ಬೈ ದಿ ಇಂಜೆಕ್ಷನ್ ಆಫ್ contaminated food and water. The Vibrio cholera is spread from one person to another person through the contaminated food and water. That is the fecal oral route I have told. Okay, ಒಬ್ಬರಿಂದ ಇನ್ನೊಬ್ಬರಿಗೆ ಹರಡೋದು ಯಾವ ಥರ ಅಂತ through the contaminated food and water. And also you can see source of infection. Source means where the microorganism or the pathogenic organisms lives, multiplies, reproduce and propagate its species. Source means ಮೂಲ, disease means infection means ರೋಗದ ಮೂಲ ಯಾವುದು? ರೋಗದ ಮೂಲ ಯಾವುದೂ ಇಲ್ಲ, patients and carriers of cholera. Next you can see clinical features. Okay, which are the clinical features the cholera has? Typical at the time of during the time when the person is suffering from cholera, which are the symptoms he will show us? Those are the clinical features. Okay, typical case of classical cholera are acute severe diarrhea and vomiting. This is one of the main important clinical features. While the time of cholera, what happens? There is severe diarrhea. Diarrhea means loose motion, and vomiting. Both are repeating at the same time. Next you can see loss of water and salts. Due to the repeated diarrhea and vomiting, there is loss of water takes place. Loss of water and salts takes place, that leads to the dehydration. Dehydration means loss of water. Acidosis means increase the acidity level, and hypokalemia. Hypokalemia means loss of potassium. These are all the symptoms and signs may occurs. Next you can see the patients also complains intense thrust ಆಗುವಂಥ ಚಾನ್ಸಸ್ ನೀರಡಿಗೆ, sunken eyes, hollow cheeks, subnormal temperature. These signs may also develops at the time of cholera. This is about clinical features, means which are the signs and symptoms develops at the time of cholera. Next you can see okay, you can see now the prevention of cholera. How can you prevent and control the development of cholera? How can you prevent? For the prevention of any type of disease, not only cholera, you can follow 3 preventive measures. One is primary prevention, second one is secondary prevention, third one is tertiary prevention. By following these 3 preventive measures, you can prevent not only cholera, all types of both communicable and non-communicable disease. Yes, what is primary prevention? Okay, 1 minute. Action taken prior to the onset of illness, which removes the possibility of disease that will ever occur. Means the actions which you are taken prior to the onset of illness, ಅಂದರೆ ರೋಗ ಬರೋಕ್ಕಿಂತ ಮುಂಚೆ ಅದು ಬರಲಾರ್ದಂಗೆ ನಾವು ತೆಗೆದುಕೊಳ್ಳುವಂಥ ಕ್ರಮಗಳಿಗೆ ನಾವೇನಂತೀವಿ? ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತೀವಿ. ದ್ಯಾಟ್ ರಿಮೂವ್ಸ್ ದಿ ಪಾಸಿಬಿಲಿಟಿ ಆಫ್ ಡಿಸೀಸ್ ದ್ಯಾಟ್ ವಿಲ್ ಇವರ್, ಅಂದರೆ ಮುಂದೆ ಫ್ಯೂಚರಲ್ಲಿ ಬರುವಂಥ ರೋಗಗಳನ್ನು ನಾವು ಮೊದಲೇ ಅದು ಬರಲಾರ್ದಂಗೆ ಏನು ಮಾಡ್ಬೋದು? ತೆಗೆದುಕೊಳ್ಳುವಂಥ ಕ್ರಮಗಳಿಗೆ, ಪ್ರಿಕಾಷನ್ಸ್ಗೆ. ಪ್ರಿಕಾಷನ್ ಈಸ್ ಬೆಟರ್ ದೆನ್ ಕ್ಯೂರ್ ಅಂತ ಕೇಳಿರ್ತಿಲ್ಲ, ಆ ಥರ ಮೊದಲೇ ಪ್ರಿಕಾಷನ್ಸ್ ತೊಗೊಳ್ಳೋದು, ಬರಲಾರ್ದಂಗೆ ತೆಗೆದುಕೊಳ್ಳುವಂಥ ಕ್ರಮಕ್ಕೆ ದಟ್ ಈಸ್ ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್. This is not after developing disease. Before the development of disease in future, we have to take some of the precautionary measures that comes under primary prevention. Okay, how can you follow the primary prevention? By the interventions like, which are those? Health promotion and specific protection. Health promotion. How can you promote the health? Here, especially in cholera, in the prevention of cholera, how can you promote the health? Avoid the drinking of contaminated water. We have to always drink safe and wholesome water. That is the health promotion. And avoid the eating of contaminated food and water. Contaminated food. And avoid the eating of roadside marketing foods, because the flies may have carry the infection from the feces to food. Okay. Next, what can you take? Avoid the eating food kept open, because the flies may have carry the infection. By maintaining all these hygienic measures, you can promote the health of the individual. Okay, that is the health promotion. Specific protection means you can take some of the specific precautionary measures to prevent specific disease. For example, immunization. If you want to prevent the specific disease such as cholera, typhoid and TB, they are all having immune developing systems such as vaccines in the form of vaccines. By taking those vaccines, you can prevent the specific disease developing in future. That is specific protection. These are all comes under the primary prevention. Next, you can see secondary prevention. Secondary prevention means the action which halts the progress of the disease at its initial stage and prevents complications. Action which halts means stop the progress of the disease. Progress at its initial stage. And ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್ ಯಾವಾಗ ಮಾಡ್ತೀವಿ ನಾವು? ರೋಗ ಬರೋಕ್ಕಿಂತ ಮುಂಚೆ ಅದು ಬರಲಾರ್ದಂಗೆ ಇನ್ ಫ್ಯೂಚರ್ ಡೆವಲಪ್ ಆಗಲಾರ್ದಂಗೆ ನಾವು ಪ್ರಿವೆನ್ಷನ್ ಮಾಡ್ತೀವಿ. ಸೆಕೆಂಡ್ರಿ ಪ್ರಿವೆನ್ಷನ್ ಯಾವಾಗ? ಇದು ಬಂದ ಮೇಲೆ ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲಿ ಇದ್ದಾಗಲೇ ಏನು ಮಾಡಬೇಕು, ಅದಕ್ಕೆ ನಾವು ಏನು ಮಾಡಬೇಕು, ಪ್ರಿವೆನ್ಷನ್ ಮಾಡೋದಕ್ಕೆ ಸೆಕೆಂಡರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತೀವಿ. ಅಂದರೆ ಅದು ಮುಂದೆ ಪ್ರೋಗ್ರೆಸ್ ಆಗಲಾರ್ದಂಗೆ ಅದನ್ನು ಅಲ್ಲೇ ತಡೆಯುವಂಥದ್ದು. ಅದು ಯಾವಾಗ? ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲಿ ಇದ್ದಾಗಲೇ ಮಾಡುವಂಥದ್ದು. ದಿಸ್ ಈಸ್ ನಾಟ್ ಇನ್ ದಿ ಸೆಕೆಂಡ್ ಸ್ಟೇಜ್, ಥರ್ಡ್ ಸ್ಟೇಜ್. ರೋಗ ಬಂದ ಮೇಲೆ ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲೇ ಮಾಡಬೇಕು. ಆಫ್ಟರ್ ಡೆವಲಪಿಂಗ್ ಡಿಸೀಸ್ at its initial stage, you have to prevent that. That comes under the secondary prevention. And by following this, you can prevent the complications. The secondary prevention is you can follow by the two interventions. One is early diagnosis, second one is adequate treatment. Early diagnosis means when the patient shows any signs and symptoms of that particular disease, immediately identify the case and send for clinical diagnosis. That is early diagnosis. Adequate treatment means when the patient, if the case is proves to be positive, immediately start adequate treatment to prevent the progress of the disease at its initial stage. ಏನು ಕೇಸ್ ಏನಾದರೂ ಪ್ರೂವ್ ಆಯಿತು ಅಂತ ಹೇಳಿದ್ರೆ ಇಮಿಡಿಯೇಟ್ಲಿ ಅದಕ್ಕೆ ಸರಿಯಾದಂಥ ಟ್ರೀಟ್ಮೆಂಟನ್ನು ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕು. ಯಾಕಂತ ಹೇಳಿದ್ರೆ ಅದನ್ನು ಅಲ್ಲೇ ಸ್ಟಾಪ್ ಮಾಡೋದಕ್ಕೆ, ಮುಂದದು ಪ್ರೋಗ್ರೆಸ್ ಆಗಲಾರ್ದಂಗೆ ತಡೆಗಟ್ಟೋದಕ್ಕೆ. ದಟ್ ಈಸ್ ಸೆಕೆಂಡರಿ ಪ್ರಿವೆನ್ಷನ್. ನೆಕ್ಸ್ಟ್, ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್. ದಿಸ್ ಇಸ್ ಎ ಫೈನಲ್ ಸ್ಟೇಜ್ ಪ್ರಿವೆನ್ಷನ್. What is tertiary prevention? When the disease has advanced beyond its early stage, still it is possible to accomplish prevention. Means tertiary prevention ಅಂದರೆ is secondary prevention ದಾಟಿ ಅದು ಫಸ್ಟ್ ಸ್ಟೇಜನ್ನು ದಾಟಿ ಅದು ಸೆಕೆಂಡ್ ಸ್ಟೇಜ್ ಅಥವಾ ಥರ್ಡ್ ಸ್ಟೇಜಿಗೆ ಹೋಗಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ, ಅರ್ಲಿ ಸ್ಟೇಜ್ ದಾಟಿತ್ತು ಅಂದರೆ ವೆನ್ ದ ಡಿಸೀಸ್ ಆಸ್ ಅಡ್ವಾನ್ಸ್ಡ್ ಬಿಯಾಂಡ್ ಇಟ್ಸ್ ಅರ್ಲಿ ಸ್ಟೇಜ್ ಅಂದರೆ ಅದು ಮೊದಲ ಹಂತವನ್ನು ದಾಟಿ ಕೂಡ ಮುಂದಿನ ಹಂತಗಳಿಗೆ ಹೋಗಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಸೆಕೆಂಡ್ ಸ್ಟೇಜು ಥರ್ಡ್ ಸ್ಟೇಜಿಗೆ ಹೋಗಿತ್ತು ಅಂದರೆ ಅಂಥ ಪೇಷಂಟನ್ನು ಬಿಡಲಿಕ್ಕಾಗಲ್ಲ, ಅವರಿಗೂ ಕೂಡ ಕೆಲವೊಂದಿಷ್ಟು ಪ್ರಿವೆನ್ಷನ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್. ದಟ್ ಈಸ್ ಡನ್ ಬೈ ದಿ ಟೂ ಇಂಟರ್ವೆನ್ಷನ್ಸ್. ಒನ್ ಈಸ್ disability limitation, second one is rehabilitation. Disability limitation means if the person is losing any organs or any parts due to the any type of disease, you can limit that by trying in your level best. Next, rehabilitation means this is one of the ಪುನರ್ವಸತಿ ಅಂತ ಹೇಳ್ತೀವಲ್ಲ ನಾವು. If the person is lost something due to the any type of disease, you can rehabilitate him. There are so many types of rehabilitation, such as vocational rehabilitation, functional rehabilitation, physical rehabilitation, emotional rehabilitation, social rehabilitation. By following all these rehabilitation procedure, you can promote him to start new life. ಅವನಿಗೊಂದು ಹೊಸ ಜೀವನ ರೂಪಿಸಲಿಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿ ಕೊಡಬೇಕು. ಅದಕ್ಕೆ ನಾವು ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಅಂತೇಳಿ ಕರಿತೀವಿ. ದಿಸ್ ಈಸ್ ಕಮ್ಸ್ ಅಂಡರ್ ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್. By following these preventive measures, primary prevention, secondary prevention, tertiary prevention, you can prevent the not only cholera, all types of disease. Okay, this is about the communicable disease, that is cholera. I think you understand. Please like, share and subscribe my channel. Thank you.